Say hi to everybody. I'm excited to be here. Got a great program. We've got 8 great webinars. I'm doing 4. Dr. Eugene's doing the other 4. You're going to love what he's got to offer. So we're going to build some momentum. We're going to go through all of this. Abnormalities found on scars in asymptomatic people. Is the abnormal the new normal? The real question is, so many patients come into me and ask me, can I have an MRI? I need an MRI. And I always want to tell them, look, I treat patients. I don't treat MRIs. This really encapsulates that statement for me. So what comes first, pain or injury? I am not really sure. But the ultimate, what you should diagnose, or at least your fundamental question is altered motor control. It's not pain or injury. It's what damage you did to your brain. Because if you don't retrain your brain through proprioception, those injuries are going to occur again and again and again. Let's dig in a little bit on the idea of what I'd like to refer to as the 3 phases of care. Number 1 phase is injury. And then you go into phase 1, your acute phase, your protective phase. That's in the first 3 to 5 days of injury, typically the first 72 hours. Phase 2, your subacute phase, one of your longer phases. There's 2 sub-phase 2s, and phase 2s would refer to the idea of the subs would be a repair and a remodeling phase. Phase 3 is your ongoing care, your wellness care, your protection care. So let's talk a little bit about the 3 phases of care. Now, I use proteolytic enzymes on the bulk of my patients. What you should know about these powerful enzymes. Number 1, if you take them with a meal, they function as a digestive enzyme, but they don't work as a proteolytic enzymes. These are enzymes that are proteins that facilitate chemical reactions in living organisms. All of your tissues, muscles, bones, organs, and cells are run by enzymes. The subacute phase, that repair and remodeling phase. I'm a big proponent of collagen. Collagen promotes healthy joints, bones, ligaments, and tendons. I would then look at cartilage and soft tissue and herbal support for joint and muscles. Let's get into those MMPSs once again. They're enzymes that damage collagen and connective tissue. We're going to have some very evocative slides coming up. Matrix metalloproteinases, collagen digesting enzymes naturally produced by the chondrocyte during the time of injury. So take a look at this. Here we have the chondrocyte. They are released in a chondrocyte in response to injury. You've got your collagen triple helix. Let's take a look. What do those MMPs look like? You would see that they, or at least you would say they look like Pac-Man. They come in and they eat the collagen. They degrade the collagen during a time of injury or inflammation. The key is to be able to modulate the expression of MMPSs. So what formulas, what nutrients would I recommend? Well, the nutrients that impact MMPSs are hops and berberine. They modulate MMP13. Selenium is known to help address MMP1 and MMP2. Folic acid has a positive impact on MMP9. FYI, MMP9 is the matrix metalloproteinase that damages the blood-brain barrier. To support the growth and construction of connective tissue, a great amino acid complex that provides specific amino acids, predominantly glycine, proline, and lysine. The micronutrients of vitamins, B vitamins, L-taurine, silica, zinc, etc. are examples of micronutrients required for healthy collagen formation. You mix that with your collagen complex, you're really going to have a good day. You're going to knit up that injured area. So let's talk about these selective kinase response modulators. They're quite interesting in that the selective kinase response modulators or signals. So anything, and it's not just a thein or rhea, it's all these different hops. Even alpha-lipoic acid is a selective kinase response modulators. It responds and turns the volume down. Excuse me, sorry, I'm going to go back. The volume down on NF-kappa B, not allowing the inflammatory pathway of PGE2 to be stimulated. So let's bring that in again, and you're going to down-regulate that COX-2. However, if that person has been in pain for a while, my suggestion to add to the hops in the formulation, especially in a chiropractic practice, I would recommend adding omega-3 fatty acids, curcumin, and ginger also. Vitamin D is a critical vitamin for everybody. This study talks about how it helps with chronic non-specific musculoskeletal pain. So my suggestion is D3 with K2 has a spot in everybody's musculoskeletal medicine cabinet, if you will. So here's the mechanism of action, a summary of all these different herbs. And when we really look at it, it gets real interesting. So curcumin, xanthocumol, boswellia, and ginger. Somebody comes in with a rotator cuff injury. What are you going to recommend? Well, phase one, if it's an early injury, the nutritional protocol would be the acute phase. So it would be your proteolytic enzymes. You would want some early natural anti-inflammatories, which will help with joint discomfort, like boswellia, turmeric, and ginger. And you would want nutrients to relax muscle tissue, like calcium. I want to expand on that thought process for a moment. I really want to delve into the idea, and hopefully we can have a discussion about, is a disc injury inflammatory? Is a disc injury systemically inflammatory? And can a disc injury lead to autoimmune conditions or autoimmune responses? MSM, it's an effective synergistic sulfur donor. Most people with osteoarthritis are deficient in sulfur. Some additional ingredients, etriol. It's a proprietary extract of New Zealand green-lipped mussels. Studies show that ETA oils from sea mussels are more effective in reducing inflammation than aspirin or ibuprofen. You mix those omega-3 fatty acids with vitamin D, because once again, you're seeing musculoskeletal, immune, autoimmune conditions be present with those people who are vitamin D deficient. It's interesting that PEA works in the cannabinoid system. It helps promote relaxation and healthy nerve function. It's produced naturally in every cell of the body in biological response to inflammatory markers.